Hi guys, welcome back to my channel. So how are you guys? So today I will discuss about the people who are suffering from bloating and those who have acidity, heartburn, and a gas problem. Whenever they consume diet which are like some dals are like rich in proteins like rajma and mm, chana and this type of dal. When they consume, sometimes what happens, they and roti and in unhygienic condition, or people coming from their work and eating unhealthy junk food. So sometimes what happens, and students residing in the college, so they are like could not eat proper food, and people traveling to places could not eat properly. So what happens in this condition, and people living in the mess or hostel food, so they suffer from bloating, indigestion, and especially heartburn problems. So what we can do is the management technique, so that to reduce the bloating, to reduce the gas from the stomach, to reduce the stomach indigestion. So what we have to do, and also diabetes patients who are suffering from diseases, and they got acidity, and acetone release and fructose release from the body, and acidity, so they also on gas problems, and gas problem in the stomach. And guys, there are a lot of issues that happens on the stomach, and due to those people get um, uh, hypertensive, blood pressure increases in people. And guys, what happens to them is that they suffer from like a bowel problem also. Bowel movement doesn't occur that much, and a bowel problem also. So yeah, improper digestion. So what are the healthy measures through which we can manage this heartburn and indigestion and bloating problem? First of all, management tricks. First of all, what you have to do is you have to eat healthy food. Okay, no junk food. Either you make the food at your home and go to the office. You have to be stable wherever you stay. And go to the office. Avoid as much as junk food you can, remove, cut off your diet. Or if you are like having junk food also, yeah, or either if you are eating outside also, you should eat somewhere where they are having hygienic condition, and there is no digestion problem and in the stomach. So due to unhealthy food habit also, people suffer from lot of indigestion. And especially in cities, in big cities, there is major chances of indigestion in the stomach. And people who are working, especially who have sitting jobs, they suffer from indigestion and heartburn, and lot of issue, bloating problem. And guys, due to lack of bowel movement on the mm, uh, large intestine, and from the rectum. So what you have to do is management technique. So guys, first of all, you can you can have this sodium alginate and sodium bicarbonate and calcium carbonate oral suspension, that is Gavison company. So guys, this is so there are a lot of companies which for which act as an antacids, and which are like gas relieving gel, gas relieving liquid. There are a lot of companies making it, but Sodium alginate, sodium bicarbonate, and calcium carbonate oral suspension is mainly given in patients or people who are like suffering from diabetes because of mainly acid content, and there are also the people who are suffering from indigestion. They can also use it, but primarily if you are suffering from diabetes, and for that you are having acid production in your stomach, and you feel acidity, then you can have it. And it's not fast acting, like if you are having it, it will not act within 2 to 3 minutes. At least minimum 3 to 4 hours it need for proper resting. At that time, what you have to do is, for preliminary treatment, is measure their blood pressure. And because due to bloating and gas, people suffer, like people have shooting blood pressure, so their blood pressure also increases in the body. So what you have to do is measure the blood pressure, and doctor will prescribe you about the medicine. But still you can, for mild hypertensive, you can have amlodipine, and you can also have a telemusartan tablet. So these are the two antihypertensive drugs you can have for antihypertensive drugs for reducing the blood pressure. So that's the two drug primarily you can have. And guys, you have to measure your blood pressure and then you should have, because it's not compulsory that people are suffering from this. The diet you have to drink is after you get relief, is like light food, coconut water, and water, lots of water, electrolytes, like oral rehydration drink. And also you can have for fast acidity eno and all, but eno sometimes doesn't work. But best is for acidity, you need base. Acid get neutralized by base. It's a simple science, it's a simple science. So it's a simple science, you know very well that acid get neutralized by a base. So whenever acid formation is there, any gas formation is there, so it's a base, bicarbonate. So you know very well that it's a bicarbonate. Bicarbonate is a base. So bicarbonate is a base. So it's um, very easy to understand. If you have acidity, it will be neutralized by base. So after it got neutralized, you have to depend on light food for the preliminary treatment. But still you have a lot of issues, then only, like if you are not getting relieved after you are like treating yourself at your home. After, if you think still not comfortable, then you should definitely visit a doctor and show what is happening. If you need any other treatment, like secondary treatment, what are the disease, if you are suffering from any type of stones, or kidney stones or any kind of stone, that is the secondary treatment. Okay, but the primary treatment is what this you have to do. But if you get relieved, so if you get relief by using simple remedies, like sometimes people are suffering from gas, they find that they don't have any diseases, but due to improper diet or improper food, they got acid attack, or they get acidity. So for that purpose also you can use this simple measure, so that you don't suffer from any kind of indigestion, and any kind of problem in your life. So that will be a big failure in your success. So yeah, if you are ill, if you're unhealthy, it's a big failure in your success. And the people who is like always dreaming, so if they have any diseases, in the night they cannot wake up in the morning and go to the place where they wanted to fulfill their dreams. So yeah, one step behind. So you should uh, what you have to do, you should know about all the details. If you're traveling also, going somewhere also, you should know about all the details. You should have your medicine box with you wherever you go, so, because you don't know what you will be suffering from. So if you're traveling, you're going to office, you're going to somewhere, you should have a medicine pouch with you. You should have all the medicines that you need, so that you don't suffer from any kind of problem or any kind of roadblock to your own success. So guys, thank you very much, and मिलते हैं फिर आपके साथ नेक्स्ट ब्लॉग में with the next information. Okay guys, bye bye.